your RT coordinator assigned me to. Before you perform venipuncture, you must assess your patient. So first, you must assess na patient must be assessed before administering medication. Patient history in allergy, normal van, 5 to 25 mgdl, and your normal creatinine 0.5 to 1.4 mgdl. Get it? Okay, class, so this is a part of your syringe. First, we have the plunger. And second, we have the barrel. And the third, needle and the cap. So the most common vein for site injection are basilic vein and the cephalic vein. For site selection and anatomy, never use an arm with any of the following: fistula, shunt, decreased sensation, edema, and on the side of a mastectomy. Difference between arteries and veins. Duterte, what is the color of vein and artery?
Sa vein is dark red, sa artery bright red.
Okay. Arima, so about pulsation?
In vein, absent, while in artery, present.
Shoemaker, about in valves?
Presence is a vein, absence is a artery.
How about in education?
In vein, superficial and deep, while in artery, deep only and surrounded by muscles.
You unknown student.
So before you start your venipuncture, there are 4 important things that you must verify. First, your physician's order. Second, your patient's identification. Third, allergies. And the fourth is glucophage. So these 4 important things you must not forget because this is very, very important. So before we proceed to the site preparation, there are techniques for venipuncture. Follow one of 2 courses. Shoemaker, what are those?
Number 1 is direct method or step entry method, and number 2 is indirect method.
Okay, very good. For your medication preparation, place the tip of the needle above the level of fluid before injection of air to decrease air bubbles in the solution. Safe recap methods. When recapping a syringe, use a one-handed method. So for the site preparation, first, prepare the site for venipuncture. Second, injection procedure. Put on clean gloves. Apply the tourniquet 6 to 8 inches above the intended venipuncture site with its free end directed superiorly. Stabilize the vein and enter the skin with the needle at a 45-degree angle. Release the tourniquet after the venous access has been obtained. Do not permit tourniquet to touch needle. Anchor the needle with tape to secure placement and administer the medication. Needle removal and discard procedure. Remove the IV access. After that, discard needles in venipuncture-resistant container. Never forget to explain the procedure to the patient. Check all medication for expiration dates and check to see that all emergency drugs are present and for to obtain a baseline blood pressure prior for injection. What are the common emergency medications? Detected.
Antihistamine to block the release.
Shoemaker.
Steroid, control inflammation.
Correct.
Epinephrine promotes vasoconstriction.
Correct. So there are possible side effects like infiltration, extravasation, example, swelling, tenderness, and redness of site rejection. Second, adverse reaction to contrast, like mild hives, mild nausea, and mild vomiting.
Sulit. Sulit. Kung kaya ba mo?
Mild hives, mild nausea. So there are possible side effects. The infiltration, extravasation like swelling, tenderness, and redness of the site. Second, adverse reaction to contrast. Mild nausea, mild hives, and mild vomiting. The severe shortness of breathing and severe shock. Okay, class, thank you for your cooperation. Class dismissed.
It's quite simple to set up an intravenous line, but there are a few tips that can make the job easier. The intravenous fluid hangs at the bedside. Remove the protective cap on the sharp end of the tubing and insert it into the opening, being careful not to penetrate the side of the bag. With the tubing occluded in the roller clamp, squeeze till this chamber is half full. Then, unroll the roller clamp, making sure to protect the distal end of the tubing and to keep it lower than the chamber. Flush the tubing, vibrating the line gently to drive bubbles along the line and safely out. This vein on the dorsal surface of the hand is the usual choice for the IV line. Prep the skin with alcohol or betadine. A little traction on the skin, a shallow approach to the vein, and the slight flashback into the needle shows that you're in. You apply a little pressure to the puncture site to control any bleed back before attaching the line. The distal end of the tubing screws firmly into place. Hold the catheter in place while you check the tubing to ensure flow. And protect the insertion site. The intravenous line insertion can be uncomfortable for some patients. If time allows, you can numb this delicate area with a subdermal application of lidocaine. You will inject just beside, not into the vein, and just below the surface of the skin. As it infiltrates, you'll see a wheal being created, a small protrusion, just enough to numb a small zone around the puncture site.